Every day, hospitals and health systems see patients who are impacted by many types of violence, including human trafficking. To call it an invisible problem doesn't quite capture the reality. There are signs that a person and community may have been impacted by abuse, neglect, or violence, including labor or sex trafficking. But you have to make a point of looking for such signs. And CommonSpirit's Violence and Human Trafficking Prevention and Response program does just that, by enforcing their violence and trafficking prevention and response practices across health systems and communities. This podcast will explore how two distinct programs, aligned together amidst a pandemic, found ways to make this work a bright spot in the organization. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly, Executive Speechwriter for AHA. AHA's Hospitals Against Violence, or HAV initiative, provides tools and resources to hospitals and health systems combating community violence and violence in the workplace. And a new offshoot of that initiative, HAV's Combating Human Trafficking, focuses on providing tools to healthcare professionals to improve their responses to victims and survivors of trafficking. Sharing stories that inspire is part of this important work, and today we're pleased to welcome two experts equipped with great stories to discuss the importance of mission-driven programs that raise awareness of and combat human trafficking in the communities their hospitals serve. Laura Krauser is System Director of Advocacy Programs at CommonSpirit Health, and Holly Austin Gibbs is the Director of its Violence Trafficking Prevention and Response Program. Laura and Holly, thank you both for joining me today on this Advancing Health podcast. Let's start by discussing CommonSpirit's initiative United Against Violence, which is the Violence and Human Trafficking Prevention and Response Program.
Yes, thanks so much. That is absolutely what it is. And we'd like to talk a little bit about the components of the program. I work on more of the external-facing components, which include our community-based efforts. Those efforts are really community-owned, community-driven violence prevention programs that are multifaceted, recognizing that there is no singular solution to any form of violence, but rather in order to address violence and really get to the preventing of violence, we need to have many different action plans, many things at work, many different programs, and really coming at an issue from all directions that we can, and working again with a broad spectrum of stakeholders within the community. So really reaching out and including anyone and everyone that should be involved in this. We would say cast a really broad net so that you have all the voices at the table. You have those who have survived violence, those who are from law enforcement, those from the schools, from nonprofits, individuals, any and every concerned person should be a part of these kinds of initiatives. And I would say in addition to the community-based work that we do, we also address violence using public policy initiatives and our shareholder advocacy, because we recognize too from the system level perspective of a health system, we can really impact social norms and the culture of violence through these other initiatives as well.
Yeah, and I'll add this. So this is Holly. I oversee the internal efforts to address violence and human trafficking among our patients. So we implement policies and procedures to guide staff on how to identify patients who may be impacted by any type of violence, including human trafficking, how to offer victim assistance to this person in a trauma-informed manner. And we also implement education to educate staff about various types of violence, including human trafficking, and also trauma-informed care and services, or trauma-informed approaches to patient care. We also oversee case debriefings and other efforts to improve what we're doing. We want to constantly be looking at how we can improve our policies, our procedures, our education, and so on. And all of these efforts are multidisciplinary. We're involving system, divisional, and facility-based leadership, as well as representatives for many different types of professions, from physicians to social workers to nurses to chaplains, as well as security staff and patient registration staff.
And of course, as you've been designing these programs and procedures, you experienced a historic merger of Catholic Health Initiatives and Dignity Health. So how did you approach bringing the different programs together?
When we were coming together, the new organization identified what they called bright spots. And these were promising programs that leadership felt really reflected the organization, our mission, our vision, our values, and also were programs that had been working well and were scalable. And so on the CHI side, or Catholic Health Initiative side, our United Against Violence program, which really is that sort of community-based program along with the public policy and shareholder advocacy and education and awareness and workplace violence prevention, our big multifaceted program was identified as one of the bright spots. And also on the dignity side, the human trafficking response model that were so brilliant about was identified as another bright spot. So, we had the fortune of having two issues addressing and preventing violence identified, which I think speaks volumes about our leadership's commitment to this very important work. And Holly and I early on realized that what we had when we put these two together is a beautiful, very holistic model that does address violence using a trauma-informed, patient-centered approach that extends into the community, connects into community, into secondary and tertiary forms of prevention, and then also within that community seeks to prevent violence from happening altogether. So we have something that we think is very unique, especially because our organization has dedicated such resources to this, and they have made it a priority for us. So it really has been, I think, unique, and we're really excited to see what we can do when we have all of these pieces working together. Holly, would you say anything? How would you add to that?
I agree that a key factor is the support that we have from leadership. So the individual programs were supported by leadership at Catholic Health Initiatives, or CHI, and at Dignity Health. And then after the alignment, CommonSpirit leadership continued to support the two programs as they both align with CommonSpirit's mission and values. And so it was a very natural fit for Laura and I to combine the programs to effectively address violence and human trafficking, both in our facilities and in our communities.
As you mentioned a moment ago, leadership, or really the buy-in, has to start at the top in order for approaches like this to be successful. So how did you and your leadership support a comprehensive approach to violence prevention in all its forms?
Again, with leadership support, it's been very easy. I think the one really nice thing I can say, because leadership has put this out there and been very public about this commitment, which is extremely important. But it also, that kind of support within leadership really allowed Holly and I to come together in what I would call a pretty fearless way. No alignment of two organizations as big as these two is ever, just smooth sailing and easy. And by that, I mean, there's fear, there's concern, and I think there's a lot of people wondering what the future brings. This kind of support allowed Holly and I to come together and be fearless and say, whatever we're creating here is going to be all the better because it's now combined, and it's going to only be richer and stronger and allow us to do more of what we're supposed to be doing as healthcare providers, which is trying to be involved in all aspects of health, not just treating what comes into our facilities as illness or injury, but also really, what are we doing to be a part of promoting health and creating communities, populations that are healthier. So I think, again, I just can't stress enough the leadership involvement in this and the trust that they placed in us as we developed this has been just absolutely essential.
Yeah, I would add both programs were very strong from the beginning of CommonSpirit. So together, they're even stronger. When we first began the Human Trafficking Response Program at Dignity Health, we were very focused on identifying patients who were impacted by human trafficking and how to respond appropriately. That organically grew into recognition that different types of violence overlap. Different types of violence can have similar signs and symptoms. And so all of our efforts changed from being focused on human trafficking to being focused on all types of abuse, neglect, or violence with a specific intention of including labor and sex trafficking. So because we were already at that point once CHI and Dignity Health aligned, again, it was a perfect fit for the two programs to address violence in all of its forms in our facilities and in our communities.
So, what advice would you have for other organizations that are interested in widening their scope of activities on behalf of patients and how implementing screening procedures to look for violence and signs of human trafficking? How do you get started? How do you sustain support? What advice do you have for your peers that would like to do something similar?
Yes, that is such a great question, because I think when people hear about these kinds of programs, there's just so much passion. And we live in a time where we've unfortunately seen such a huge amount of violence in our society, which just makes it all the more important that when people want to be part of the solution, they can be. And I would say, first of all, I don't think there's a need to recreate the wheel. We have a lot of resources. We have a model for how you go about creating a community-based violence prevention initiative. There are many resources that Holly can get into the internal response piece. And, one of the reasons we're so thrilled to be able to talk on a podcast like this is because we want to proliferate this. We want to help people do this work. So I think there's two things that I think of when you think about how these kinds of programs are successful. And I kind of think of it from a grassroots up and a top-down approach. Of course, leadership, I can't stress how important that is. So if you find that leader champion, within the upper ranks of your organization, I think that's very important. But I would say simultaneously, there are so many impassioned people that can drive this whole kind of initiative from the grassroots up too. I think when you can get both going, you really get buy-in in an organization that almost makes it impossible to not do the work. So that would be my advice for anybody listening and thinking, boy, I'd really like to get my system or my hospital involved in this. I say look for both areas and try to work from the bottom up and the top down, and you meet in the middle and really get the work done.
I agree completely. There are a lot of resources out there now around how to begin a program that addresses both community-based efforts or facility-based efforts to prevent various types of violence, including human trafficking, and how to identify patients and assist patients who may be impacted. There are educational modules and guidance available from the government. There are several organizations offering guidance and materials. CommonSpirit, we share our model publicly on our web pages, and we share all of our resources. So we have educational modules on human trafficking, trauma-informed patient care and services, and on some key components to our abuse, neglect, and violence policy. We also share posters and brochures that are designed in collaboration with survivors of labor and sex trafficking to try to reach out to patients who may be impacted by that type of violence. So there's resources out there that health systems can tap into or use as example templates for implementing their own efforts.
Well, you're off to a terrific start in tackling a very serious problem. But what comes next? Where do you go? Can you grow? Are there new directions to pursue at this point?
Yeah, we sure can. So we have several pilot locations now where we can really begin to see what this aligned model looks like and how it best works. And I think that because, we're in the beginning stages of this, I think there's just all the more to uncover and discover and perfect. We want to create systems that really work and are effective. So I think that as we expand our pilot locations, and we certainly want to do that, what we'd like to see is every facility across the CommonSpirit footprint have this in place. And we don't think that that's impossible anymore because we are finding creative ways to do this work. And again, just a huge amount of passion. And that is essential. And so I think that we'll see a lot coming out from that. And hopefully we'll just continue to be able to develop resources that will be meaningful and will help people and help us to find new and better ways to do this. We can always improve.
Yeah, I would say as we continue to expand our pilot sites, meaning locations that have efforts to address violence and human trafficking, both in the facilities and in the communities, we're also looking to streamline and institutionalize our efforts. So one way that we're doing that for internal efforts is we're creating a system policy on abuse, neglect, and violence. So it's a global guidance for physicians and staff on how to identify patients who may be impacted by violence and how to offer assistance in a trauma-informed manner. And we're creating our educational modules in a way where they can be accessed by anyone at any facility in any shift through the online learning management system. And we're looking to attach credits, learning credits, to add incentivization to for folks to take the module. So in other words, we're trying to make these resources available to anyone, everywhere, so it expands and streamlines even quicker.
Well, it sounds like you've got some ambitious plans for growth, and I wish you every success in getting to where you want to go. So before we conclude, any final thoughts you'd like to share with our listeners?
One thing that I think is really important for us to remember is the time and space we are in. COVID has presented obviously so many challenges, but not the least of which is with regard to violence. We may be seeing less violence, within our facilities. We may be seeing, when we are seeing it, we're seeing it worse than ever. I mean, it's not because violence isn't happening. We know it's happening even more in the kinds of constraints within COVID, close living quarters. I mean, there's so many things that are going to factor into that when we emerge from this pandemic, we have a population that is going to be very, very wounded. So if there was ever a time for us to focus on addressing violence and preventing violence, the time is now. It's going to be needed more than ever.
Yeah, I would add to that, if any leaders are listening, please consider taking a stand at your own system, your own facility, to implement procedures or initiatives to address violence and human trafficking in your own community and among your patients. Anything that you do to equip physicians and staff to identify patients who are at risk and support those patients, you're supporting not just your patients, but also your staff members. All the education that we provide to our staff on trauma-informed approaches to care, it isn't just about identifying trauma in patients and finding ways to respond to patients, but also recognizing secondary trauma in ourselves, in our colleagues, and finding ways to promote self-care and staff resiliency.
Thank you so much, Laura and Holly. Great thoughts. And congratulations on CommonSpirit Health's outstanding work and the example it sets for others. This podcast is part of a series of stories so that we may continue to raise awareness and fight human trafficking together. For more resources and tools on violence prevention, please visit www.aha.org/hospitals against violence.